from Amity University, Mumbai. So this is my area of topic, an exploration of psychosocial issues and the need for intervention for parents of children having cancer. So cancer, as if everyone knows, it's a disease or a terminal illness, which is of a great concern in the current society. And this topics gives us more information about how much, as a psychologist or probably a health worker, interventions are much needed, basically for children and their parents. So parents, as of children with cancer, face significant psychosocial challenges, and it is crucial for providing effective support and intervention. So these are some of the common psychosocial issues, like anxiety, depression, where we could see high level of stress, anxiety, and depression due to the child's illness has been seen. And one of the major thing is financial strain, which because of the treatment that leads them to a financial hardship, and then social isolation, then guilt and self-blame, and impact on siblings relationship, where in guilt and self-blame is the more so because parents feeling responsible for their child's illness, and they think it's because of them they're having all these issues. And so basically speaking about the importance of intervention, so we could say, what is intervention? Intervention is basically something that helps a person to increase his quality of life. That is, we can say, about biological, psychological, or social perspective areas. And so mainly importance is, as I mentioned, if it's emotional support, then it gives a financial assistance, then social support, then it is much more used in the education information, so that people, like we are educating parents about the illness and treatment that can reduce their anxiety, and which can help parents to support their children having cancer. Then some of the types of intervention are psychological counseling is there, then financial planning, which we can offer them, then social work services, education program, and peer support. So in my current research, these are some of the research questions, which are, what are the emotional burdens experienced by parents of children with cancer? How do parents navigate the social challenges associated with the child's diagnosis of cancer? What are the potential long-term psychological effect on parents after the child's treatment for cancer? Then what existing research support for the effectiveness targeted intervention for parents of children with cancer? So I have used a mixed method actually. So this is a quantitative method where I used the three tools, that is BAI, BDI, and IES. Then coming to so in the demographics, I have asked about the age, gender, marital status, education, employment, and some of the social challenges and support service assessments. It was basically target population was, as I mentioned, it's parents of children having cancer and who is undergoing treatments. The sample size was 150 parents, and it was a convenient sampling. Then these are some of the tests I've used, this t-test and chi-square for variable relationships. And coming to the qualitative part, as I mentioned, it's a mixed method. The qualitative part, I use semi-structured interviews with 30 parents, which made more into a saturation level. And it was easy to explore emotional and social challenges. And I've, as it was qualitative as well, there's an interview guide, and the thematic analysis was done overall, which have open-ended questions on diagnosis, impact, and coping strategies, support, and thematic analysis was identify themes and patterns. Then coming to the result session, basically focusing upon emotional burdens, we could see 65% of parents reported moderate to severe anxiety, and 72% reported moderate to severe depression. And this qualitative insights made us understand the nature of fear, uncertainty, and emotional overwhelming parents have. And coming to the social challenges, 58% reported decreased social interaction because of the child's illness, and 45% people reported significant financial impact, which I mentioned earlier, because of the financial burdens they are getting due to the treatment plans and everything that is happening around them. And from the qualitative insights I got, results of social isolation and financial strain. And the long-term effect we could say is ongoing anxiety and depression post-treatment, because after the treatment there's a stereotyping and the stigmatizing society, which is less in number now, but they have, which is of course affecting them, and we need to mainly focusing upon that. And then they have this emotional toll of fear and guilt, where they feel like, okay, once it came and will it come again, and all those emotional and traumatic events that they have faced will come up again, disturbing them. And coming to the effectiveness of intervention, there's a support groups and therapy reduce anxiety and depression was seen. And like both support groups and individual therapy was effective, which I saw. That reduces emotional burdens for parents of children with cancer, with 70% and 65% report positive outcome respectively. If you see the graph, you can understand. There are some of these limitations of future directions, I can say. It was convenient sampling limits generalizability, which I felt could be a limitation, which I can work on further for my research. And there is future research which we can do for longitudinal studies and intervention effectiveness as well. And yeah, coming to the conclusion part, the psychosocial impact on parents of children with cancer is profound and multifaceted. Effective interventions are essential to support these parents emotionally, financially, and socially. And a multidisciplinary approach is recommended to address the diverse need of these families. And these are some of the references I have taken. Yeah, thank you.